High-value, cost-conscious care. What is this? High-value, cost-conscious care, also known as HVCCC, is not low-cost healthcare, but a cost-conscious approach to high-quality care. Quality is multi-faced. It involves taking into account the availability of sometimes scarce materials, personnel, budget and time, the efficacy of the care provided, and quality as perceived by the patient. What is the purpose of HVCCC? We want doctors to be aware that they are always dealing with shortages and tension between unlimited needs and limited options. This requires the doctor to make conscious choices as he or she is responsible. Why is this so important? Shortages are common in healthcare. The choices we make and how we deal with shortages could have major consequences. For example, a shortage of cotton swabs in the COVID-19 pandemic could shut down the entire healthcare system. Lack of a simple test component could lead to extreme measures in order to prevent contamination. This could result in inferior care, causing a major impact on the economy. What, according to HVCCC, does healthcare require? Doctors must have sufficient know-how and experience to make the right decisions at the right time. Doctors may have an understanding of costs and quality of care. They must also have an idea of the outcome that the patient regards as being important and which will improve his or her quality of life. They also must understand the demonstrable impact of diagnostics and treatment of the condition, to be proven by a systematic review. And how does one perform a systematic review? By conducting a structured literature review. Determine the primary question, establish the inclusion and exclusion criteria as a basis for selection, do a literature search in multiple databases, judge the selected articles on the basis of their methodological quality, extract data from the articles, make a meta-analysis with an overall estimate, and report. Where does HVCCC lead us? Scientific proof and the availability of the intended diagnostics and/or treatment and the preferences of the patient eventually result in feasible advice for the short and the long term, increased patient satisfaction and a better quality of life, and the best patient care at the best possible price.